everyone. I want to introduce you to Dr. Brian Mayrsohn. Dr. Mayrsohn is a pain management specialist at Maywell Health, which is a whole person pain management multidisciplinary practice, which is a great concept. He's located in New York. And we're here to talk about different types of pain management today, origins of pain, management of pain, perhaps that's a little bit atypical. They're different than what you'd normally think of from a pain management a doctor who is looking to do only, injectables and or oral prescriptions. So, of course, Dr. Mayrsohn is very skilled in all those modalities and mediums of treatment as well. But he's also very focused on whole person pain and the cognitive approach, and has elements of his practice that bring that into play too. So, I'm gonna give you the floor, Dr. Mayrsohn. You can introduce yourself. Tell us a little bit about how you think about pain management.
Thank you so much for having me and for the introduction. I was raised first and foremost by a physical therapist who always told me to never get fixated on like the joint or the part of the reason why the patient is presenting to you. So she's like, you need to look at the whole person. And that was Sherry Mayerson, by the way. I'll give her a shout.
I'd
She
always thank your mom.
Yeah, always. And my dad played a little bit of a role, but she was really very formative. Those that know my dad know him. He says, "Hi, I'm Sherry's husband, Mitch." So that kind of speaks about how things were raised in my household.
Love that.
But because of that, when I look at somebody, I always try to think out of the box. If they're presenting with a shoulder or a neck or a knee, it's looking up obviously the joint above and below, but then who is the person like bringing that body part into my practice? What are they doing in their normal life that got them into the situation? So a common example of that would be someone in New York City who's working really hard. They have neck pain. I always go to, do you have headaches, jaw pain, anxiety? Like that's a very classic triad of a patient in Manhattan because it's a pretty stressful place. We're working very hard. But if we just focus on the neck and we would lose sight of this human who has other issues that can be helped and intervened with that can impact their neck pain without any injections. Some of it would be posture correction, physical therapy, some diet, and some psychotherapy. And I think it's easy for us to get wrapped up in looking at the image because, of course, there's going to be arthritis and it's going to match their neck pain. So if we just look at the image and don't understand who this person is that's presenting to us, it's easy to get trapped into that, like, oh, I can inject that and fix that, which I certainly will fix that temporarily. But then they're going to come back to me in 2 to 3 months with a similar issue or 6 months, depending on what injection I performed. So I don't want people to have to be reliant on injections to get out of their pain. I want to empower people to help themselves get out of their pain. And I think that makes a lot of sense, even from a business standpoint, growing a company where, people can come in, build up themselves, and then if they tell their friends and family about this amazing experience that they had, we've seen a lot of word of mouth grow the practice already in just such a short period of time.
Yeah, I think that's so important. It's just about connecting on a human level, and we do the same in my practice too. And talking about the psychologicals and elements to pain and pain management is so important. And one of my favorite studies is that physical therapy outcomes are affected by the patient's experience with your administrative team. So we always think about like clinical skill, clinical reasoning, clinical performance, but that element of connecting with the patient on a human level, connecting with them on from your administrative team, making sure they have a really good experience start to finish coming into your practice. That's all part of the wellness and the medical experience, which affects
Totally.
outcomes. So when we talk about what's actually happening in the nervous system, because this isn't just placebo effect, right? Like people just think that placebo is, like a control, but often we have we have real central nervous system changes. We have neurochemical, neurotransmitter changes, different sympathetic responses that can be affected from the cognitive approach. So let's talk about some of the things that you do and maybe why that happens physiologically rather than just saying, oh, this is something that is maybe manifested.
There's so much to unpack. So many thoughts that I want to discuss about uh, the placebo effect and the touch and the because you're right, just giving somebody a hug releases oxytocin. That hug alone is a treatment. And also the mind is so powerful, it can create good and bad internally. Right? There's also the nocebo effect where people take a medication and get a side effect, but the medication was a placebo. So they should not have gotten that side effect. But their mind created the side effect because they were told these are the list of side effects.
Yeah.
The mind can control so much and influence how we feel and present ourselves to the world.
In
Um,
either direction, right? Positively or
Either
negatively.
direction.
Yeah.
Exactly. So I like to harness that positive direction, but we see that it can go negative or positive. So how do we set people up for such success? And I think bringing in that psychosocial component is how we can set them up for success by giving them the tools to be in control of their emotions, which then can regulate their pain experience. So at Maywell Health, we'll screen everyone for anxiety, depression, catastrophizing behavior, just to get a sense of, what's going on behind the facade that we put forward to the world. Because people can fake enough, but if they're true and answer the questions, and then their pain is presenting in such a way that it doesn't really follow dermatomal distribution, or maybe it's quote pain out of proportion, it gives me more context to understand like how they're showing up, and I could get into that conversation about do you have a therapist? What medications are you taking for anxiety or depression? Do you have a history of trauma? Because all of those are so relevant to the conversation around pain because emotional experiences can present as pain. And oftentimes there's this like victim blaming that can occur in medicine where the doctor can't fix or cure or identify the cause and they say, oh, it's your fault. They're just not that the physician isn't recognizing the presentation of these symptoms in their box. So I think being more open-minded about the presentation is on this like continuum that we are still learning about is so important. And just believing the patient that their symptoms are real, give them the benefit of the doubt first, and work with them to try to figure out like what else is going on here.
Yeah. I mean, we are interacting with this patient, depending on what your medical profession is, for X amount of time. Whereas the person themselves lives within their own body 24/7. No one knows themselves better than yourself, right? You're your own patient, and sometimes we overmanage that internally, right? And we try to self-diagnose, but it's as a medical professional, it's really our job to probe a little bit deeper and ask those questions, take those time to ask questions to really see how that pain is presenting or how that disability is affecting the person and what could be managed from maybe in an alternative model of care. And I think there's a distance between Eastern and Western management and how that's perhaps perceived. But what we have really kind of learned over the past decade now with a lot of, John Sarno and mind over back pain and kind of it precipitated a lot of this other interest in the central nervous system control over pain. It's a very real thing, and it's not just manifested. It's not saying this is just something that doesn't exist. It is something that you can have real prolonged change, right? So tell
100%.
us about what else you do in the practice. So who do you have in the practice that kind of works with this kind of thing?
Yeah, so in our practice, we have a dietitian, Olivia Beal. We have a psychotherapy team run by Lucas Mayrsohn, my sibling, and he has 10 therapists that work with him, all in network. And then I'm run the pain management side with the help of Rebecca Timoney, who's my PA, and um, we just have such an amazing team. Actually, we just brought on another physician, Dr. Corey Olger. So we have about 17 clinicians that all work together to try to bring their level of expertise to, again, look at the whole patient. So on the anxiety, depression, PTSD side, if someone presents with a specific type of pain, which typically would be like headaches or pelvic pain or neck pain, we're very probing on people's past experiences to try to get them into the right resources. Some people might present with, inflammatory type pain or nerve pain, or just even headaches, and diet can influence all of that. So having the right nutrients, either up or down, so cutting certain foods out or adding certain foods to the diet can change the internal milieu of inflammation, or even not just inflammation, but just influence of pain. So certain ingredients, for instance, um, glutamate, which is a very important amino acid. It's also a food additive. So MSG, monosodium glutamate, is a really common food additive that can cause headaches and it can worsen fibromyalgia symptoms. So just understanding how diet can play a role, not necessarily always in the inflammatory diet, but just in the nutrient component that can influence turn up or turn down pain signals, right? Because glutamate is the inducer of pain in the human body. So there are medications like gabapentin, right, um, which blocks the glutamate receptor from working properly. Um, that actually is one of the mainstays of treatment for fibromyalgia. So now we're thinking about the nutrient that all the way upstream from your food, downstream can cause this pain or these fatigue issues, can be cured by a medication. Well, why not find the healthy solution to it without side effects?
Yeah, definitely. The more natural approach and less medication, less polypharmacy is always ideal, right? Especially when
Exactly.
you start taking more medications as we get older. So uh,
Exactly.
that's great. I think that you mentioned like the dietary component. The GI system has so much to do with the inflammatory status of your body. Fluid retention. That can affect so many other things, whether it's blood sugar, whether it's inflammation and swelling, and there's so many things that then can have trickle down effects on any other conditions, though,
Absolutely.
right? So it's like you may have people my pinky may hurt, and you're like, how can that be affected by my GI system or my diet? It's not maybe not directly affected, but there's trickle down where things can affect your nervous system, your circulatory system, and
Yeah, exactly. I like to think of the body as this like internal milieu or this like threshold, and the threshold of just stuff is always changing. So, when you're hangry, right, your threshold to be angry changes. If you don't sleep, your threshold to be, shorter or shorter fuse changes. Well, the same is true for pain, right? When you have certain changes in that body chemistry, your threshold for experiencing pain is going to change. So, how do you identify the parts of your life that you can improve so that that threshold improves so that you experience less pain, whether it's acute or chronic pain?
yeah.
Um, and then just a point that you had mentioned about like all these things contribute, sugars, the GI tract, for instance, right, is colonnaded with so much bacteria, and we know there's an incredible interplay between the bacteria in your gut and your mind. So anxiety and depression and emotional feelings is influenced by your gut. And we also know that your emotional state can influence your pain experience. So literally, like your diet, you are what you eat, can influence what pain you experience through just your bacteria alone. So there's just so many reasons why having a nutritionist on a care team is so important.
Yeah, that's such a great point. So I think that's a great place to kind of stop and sum this up. But when we talk about pain management, we're talking about the cognitive approach, this multifactorial, multidisciplinary management of pain from dietary consultants, psychoanalytics, whether that's psychoanalytic or CBT, different strategies of therapy, and then of course pain management. But having a pain management doctor or a clinic like Maywell, you're able to plug in and have that open communication between providers, which is so important, right? So
100%. And I would just say one last thing before we wrap up, because we haven't talked about like injections or medications. And there is a role for, I think, everything. Because if I have someone who is at a 10 out of 10 pain and cannot engage in therapy, who cannot engage in physical therapy because of just the pain that they're experiencing, the purpose of a pain physician is to create a window of time where somebody is pain free or in a lot less pain so that they then can engage, right? So an injection can bring down a pain by 60 to 80 to 100%, but we know that it's a temporary window of time that that pain is gone for, and it ultimately most likely will return in a couple of months. So we use that time to push someone into their behavior change pathway,
yeah.
which is where we bring in all the complementary specialties.
Yeah. Thank you, Dr. Mayrsohn. Again, if you want to check out Dr. Mayrsohn, he's in New York City at Maywell Health. and it's a great resource. So definitely look him up, and his info will be in the notes section of the video as well. So thanks, Brian.
Thank you so much for having me.
All right.